The question is what to do the night before surgery. I love that question because a lot of people get really, really anxious the night before surgery. It's a big event. A lot of people are scared about the anesthesia, and just most people are very, very nervous. But the idea is we want you safe, and healthy, in a good state of mind for the day of surgery. So what we tell our patients the night before surgery is please, please, please don't eat like it's your last meal. Please don't do that. You're going to feel terrible the day of surgery and then afterwards. So stay with lighter foods, things are a little bit easier to digest, maybe some light fruits, chicken, simple carbohydrates. Try to avoid spicy, greasy, and salty foods as your last dinner before surgery. You want something that digests very, very quickly. That way in the morning, you have an empty stomach and you don't feel bloated, and you will feel a lot better. I trust you will feel better the day after your surgery. The next thing is drink plenty of fluids before you go to bed. Okay? You're going to be like, Dr. Miles, I have to pee all night. Well, that's not necessarily a bad thing. So you want to stay well hydrated. I would recommend you're well hydrated during the day. That way you don't drink as much during the night. So it's the kind of conditioning you should be starting to prepare for days before your night before your surgery. So stay well hydrated, because typically we require, it's called NPO, or nothing by mouth, from midnight to the morning. You're not allowed to drink anything the morning of your surgery. It's super important that you have been fasting. Okay, so it's really for safety associated with general anesthesia. The next thing is you need to be rested. I typically prescribe medication to help you relax you, to calm your nerves, make you a little anxious, to just sleep better. I assure you, if you sleep a little better, you will have a much more anxiety-free recovery and getting ready for surgery the next day. So how do you do that? Medications help. Make sure you're on your normal exercise routine. So if you're used to working out every day, work out every day. Work out the day before your surgery. Make yourself exhausted. You want it to be rest. You want your body to rest. And you will feel a lot better if you're rested the morning comes surgery. The next thing is that you want to be clean. These procedures typically are body contouring procedures, even face sometimes. You want to make sure your skin is clean. So make sure you take a good shower the night before your surgery. Don't put any oils, no lotions on your skin. You want your skin as clean as possible. If you have any hair-bearing parts of your body that will be or anywhere near the surgical field of your procedure, we prefer those are trimmed. So for tummy tucks, we ask that the area of the Mons area be trimmed or shaved, usually a couple days before your surgery. And it decreases risk of infections associated to contouring surgery, such as like a tummy tuck. So these are the procedures that will be a little more labor intensive. So just make sure you're very diligent about keeping your body clean, wiping everything off. When I see you the next morning, typically we're going to do some kind of body wipes that also further clean the skin as well. So take note of all of these things we talked about, and I wish you luck on a safe, successful surgery.